Like Renee said, my name is Jazz Shuttler. I do have kind of a few different roles here at KU Med Center, where I work in clinical practice, where I do some diagnostic evaluation as well as ongoing behavioral and social emotional support or cognitive behavioral therapy with kids and adolescents with autism or intellectual or developmental disabilities and other co-occurring mental health conditions. So I do a bit of this in practice myself. Also do some teaching and training through the Kansas Lend program. And I am also a parent of two kiddos too. And so in thinking about what I as a caregiver would want to know and understand and to get support around mental health for my loved one, but also for our whole family. I hope that the content that I'm going to talk about today is helpful to you and gives you at least maybe one new nugget or a new piece of information for you to explore. And I also hope that this becomes a space where you feel supported and seen by other folks who might share the same experience. So really glad to be with you. Um, since you've shared a little bit about yourself in the chat, thanks for doing that. If you are a caregiver of some kind, family member or other foster caregiver, supporting an adolescent or young person with autism or another type of neurodevelopmental or intellectual disability, please include that in your kind of chat introduction if you feel comfortable. I also want to acknowledge and thank many of the folks who have been a part of this work and a part of the current team of folks that I work with at KU and in my broader kind of collaborative network. You are going to see some of those folks featured on some of the slides and in some videos throughout the presentation, but I've also listed some of those folks here on this slide. And so I just want to say thank you to everyone for being here, as well as to these folks who have I'm really a part of a team of people trying to work to have an impact on this area in our field and in the state of Kansas. As we begin, as we're getting kind of ready to talk about this really important topic, but also a topic that brings with it a lot of our own kind of emotions and consideration of our mental health as supporters of people. If we aren't a person who is having that direct experience as a person with mental health and intellectual or developmental disability support needs, I just want to take a moment to acknowledge all the good work, all the investment that you're making in the lives of the people in your support circle. I also want to give us a moment just to kind of set an intention for our time together. You might even sort of choose a word in this moment for what you're hoping this next hour can bring for you. We'll take a couple of just moments for some deep breaths. Breathing in a moment of kind of peace, focus, connection, support, whatever that word is that you're looking to maybe gain through this presentation. And to breathe out any of the stressors or kind of difficulties that you might be experiencing today too. I hope this is a space for support for you. And now, having given some space for that, I'll get into kind of the plan for our time that we have together today. I want to start by sharing with you some definitions. So what are we talking about when we're talking about mental health and different types of developmental disabilities? We're going to talk about prevalence or kind of the occurrence rate of different types of mental health support needs for kids with and without disabilities, kind of across the kind of youth age span and into kind of life span as well. We're going to hopefully get into a little bit around recognizing what's like just being a teenager versus what's maybe something that warrants kind of further intervention or support, and how to maybe recognize some of those more nuanced support needs in our loved ones who may have other kind of co-occurring developmental differences, communication differences, rates of learning differences. Then we'll get into kind of those next steps of finding support. Some thoughts around ways that psychotherapy, as a main way that people can gain support, can be more accessible, and some efforts that I'm aware of and that I've been a part of to make that psychotherapy more accessible. And then we'll also share with you some ways to tap into community supports and a few resources in particular that we think would be helpful. So you are going to hopefully walk away from this um, you're going to walk away from this session understanding more about the core characteristics of autism and intellectual disability, as well as understanding more about kind of prevalence rates, but disparities in supports for teens with autism or an intellectual developmental disability. You want to understand more about monitoring and supporting mental health, and also to know about what supports are out there. Okay. And I also should say, I'm not the only one you're going to hear from. I've got some videos for you as well, and from some folks with some lived experience who are going to share their perspective. So I know we gave a moment for considerations for yourself and a little bit of a moment of kind of self-care for yourself as we're starting off today. But I also know each of you are here for at least probably one other person in your life, likely a family member, maybe a friend, a loved one, a foster child, or a student. And I just encourage you, if you haven't already done so yet, that we want to kind of keep that person at the center as we're thinking about what we are kind of what we're going to dig into today. I also want to share that, in my work, I work with a wide range of ages of children from as young as 3 or 4 up into folks in their early 20s. What I was sort of asked to share with you and what I'm going to focus on more today is supports for folks in that kind of teen range, so ages 13 and up into the early 20s range. But if you are interested in learning more about more evidence-based strategies for younger children, and especially one that is what we call like transdiagnostic, that means it can be used with and has been researched with lots of different children of different ages and different kind of developmental profiles and behavioral profiles. I'd really encourage you to check out any of the work happening around parent-child interaction therapy. And these are a couple of my colleagues, Dr. Lenny Swills and Dr. Skylar Bellinger, who offer a lot more ongoing training and information around that. Also, I'm sure Renee could share about other offerings that will be available from Kansas Family Support Center around supporting kids in those younger age ranges. Okay, so a little more audience participation here. I would love to hear from you, maybe put in the chat or think to yourself or make a note to yourself. When I say autism or neurodiversity, what does that mean to you? What do you think of? You can put it in the chat, write it down to yourself. If you're in the room with somebody else, you can tell them. When we say autism or neurodiversity, what are we thinking of? Well, I'm sure we've all know someone or are thinking of someone, or maybe our experiences, either professionally or personally, with autism. But I think it's important for us to recognize that it is different for each person with autism. So in a moment, I'm going to share a slide with some of the core sort of clinical characteristics of autism and co-occurring conditions. But before I do that, I want to, of course, bring to mind this concept of neurodiversity, which is maybe new for some folks and more familiar to others. But I think it's a really unique perspective on thinking about that there are all different kinds of brains in the world, all different ways of processing and experiencing the world, and that none of those ways are wrong or bad. But it's more about finding kind of a match of supports and environmental characteristics for all different kinds of brains that there are in the world. Um, a a quote around neurodiversity that has been really helpful for me in thinking about autism and other kinds of developmental disabilities is this idea that folks who are atypical in a society provide different perspectives that are needed to generate new ideas and new advances, and those can be advances in technology, culture, art, otherwise. So we want difference, we want diversity in our world because that helps our world be richer and more full, and for us to be able to navigate all sorts of different types of situations and different contexts. Okay. So this slide is a bit more illustrative when we talk about kind of clinically how we're thinking about autism. I like this image because I think it illustrates the complexity of the ways autism can present itself, along with kind of various kind of things that can happen along with autism, whether those be kind of behavioral, cognitive, genes, kind of medical situations, neurological differences. This is part of what makes, that saying of, if you know one person with autism, you know one person with autism, because there are so many different ways and variations to be experiencing these. But let's start with the core autism characteristics. So when we think about autism, we think about these core characteristics. One set of characteristics being social communication differences, and the other being what kind of our diagnostic manuals call restricted or repetitive patterns of behavior. So these are kind of the DSM terms to call them kind of impairments or restricted or repetitive patterns in behavior. But we also could think about them as differences or kind of needs for sameness or patterns in behaviors, in intense interests, or in significant sensory kind of differences or experiences. So anyone who kind of has that clinical diagnosis of autism kind of demonstrates kind of significantly different from age expectations in their kind of core social communication skills, as well as kind of those more behavioral patterns, sensory differences, intense interests. But along with that, folks with autism can also have, behavioral conditions that can co-occur. They also may have differences in their language expression ability, language comprehension. They may have differences in their cognitive abilities. There's so much research happening around kind of genetic implications in autism. So understanding what are the different genes that might be at play. Also understanding what is the different kind of underlying kind of brain function and structure, as well as co-occurring medical conditions. So there are a lot of things that can go along with having autism. What we're going to talk about today is about kind of those co-occurring mental health pieces that can go along with autism. So similarly, we want to talk about autism, but also intellectual and other developmental disabilities. So when I say intellectual disability, I'm curious what comes to mind. You could share in the chat, you could think to yourself, say to someone else in the room. When we are talking about intellectual disability, and this can sometimes go with autism, but it can also be separate. You can have autism without intellectual disability, and you can have intellectual disability without autism. But they both are types of developmental conditions, developmental disorders, things that start out in the early years of development during childhood usually. They're usually identified or their person has symptoms they're expressing earlier on in life, although they may be diagnosed later. So an intellectual disability, if we're thinking about some of our more clinical criteria, has to do with significant differences or sometimes limitations in intellectual functioning and adaptive behavior that occur, in those childhood periods. So when we break that down and how we kind of describe those from a clinical standpoint, we think about someone whose cognitive abilities are progressing at a slower rate than kind of age expectations. So these are folks who are certainly able to learn and acquire new skills, but they're going to do that at their own pace. And the pace that they're doing it at is at a significantly different and often slower rate from kind of what their kind of age or grade kind of expectations are. And that along with that kind of slower learning profile also comes along differences in adaptive behavior. So those skills are not progressing at the same rate as expected for age and are quite a bit different than age expectations. So they're needing a lot of extra support in terms of those kind of conceptual, social, and practical skills. Okay. There are about 1 in 31 folks right now who are identified as having autism, and somewhere around 2 to 3% of children who are identified as having intellectual disability right now. Just for background and context, I do want you all to know or be aware of kind of some historical terminology and evolutions in that. I'm not going to read these terms out loud, but they are terms that used to be used to describe people who had intellectual disability that are no longer used for that, but that we do still sometimes hear in the kind of common usage around us. And I think it's important for us all to be aware of kind of the root of some of those terms so that we may be able to kind of address them or better understand them or find different language to use to describe people. So since about 2010, there has been a law that has changed all of our kind of federal legislation, clinical documentation from the term mental retardation to intellectual disability. So that is kind of the current and most up-to-date set of terms. Okay, one more term for you. What's mental health? And just for time, I'm going to keep moving. But the way the World Health Organization defines mental health is a state of well-being that enables people to cope with their stressors in life, realize their abilities, learn and work well, and contribute to their community. So the idea of mental health is not that we've like eliminated any challenges, but that a person feels enabled to cope and manage and work through the stressors in their life. Mental health has kind of intrinsic and instrumental value to us all, and the World Health Organization would say it's a basic human right for all of us. When we think about prevalence of the rates of kind of co-occurring mental health or behavioral health challenges throughout the lifespan, I wanted to share this table with you first, or this kind of set of data first. This table shows us the overall prevalence of different types of mental health conditions across the childhood lifespan for kids who they're not necessarily diagnosed with a developmental disability. You can see for anxiety and depression, the rates of those experiences increase with age. So as we move from the younger ages 3 to 5, which are the blue bars, and then into ages 6 to 11, which are the orange, and then green, which is ages 12 to 17, we see that anxiety and depression have this uptick over the years, while behavioral disorders kind of have more of a peak and even back out into those teenage years. Across mental health conditions and ages, about 21% of children, or 1 in 5, in between the ages of 3 and 17 have ever been diagnosed with like a mental or behavioral health or emotional condition. That's according to the CDC. The last kind of data point that I was able to find was from 2021. So that's a fairly common amount for all kids in general. And then when we think about over the lifetime, estimates are around 1 in 4 to 1 in 5 adults. So regardless of kind of developmental disability status, who experience some form of mental health disorder. So this gives you kind of an overall idea of the landscape of prevalence for all kids. But next I wanted to share a little bit about prevalence rates for kids, for people with autism, and then for folks with intellectual disability as well. So I know you all are here. You have your own whys that are bringing you here, but in case you needed kind of more rationale or more data, this graphic comes from an article from 2019 that shared about lifetime kind of prevalence or co-occurrence rates across various mental health conditions within kind of autistic populations. So as you're looking across this kind of honeycomb, you can see that over a person's lifetime, a person with autism's lifetime, about 70% of those folks will be experiencing some other mental health condition at some point over the lifespan. The highest rate of a co-occurring condition was about 28% lifetime prevalence for ADHD, and about 20% of folks across the samples that they used in this research were experiencing anxiety at some point as well. And you can kind of see across from there. And then when we think about children with developmental disabilities or with autism in particular, prevalence rates can vary a little bit depending on how we kind of measure the experience of mental health challenges for kids who have autism. But again, estimates are around 70 to 72% that kids experience at least one co-occurring kind of psychiatric disorder. I can also tell you that from some of our local data, from a database that we have in our clinical practice, that for folks, for primarily young women who have autism or other developmental disabilities who are waiting to participate in a social skills kind of support group, there's a co-occurring rates of somewhere around 80 to 85% of folks on that waiting list also have co-occurring mental health conditions along with their autism or another developmental diagnosis. So this is like really important, right? This is something we really need to be thinking about and doing better at supporting. When we think about like why this might be happening, I think there's a temptation for a lot of us to think about like, okay, well, like what are the things about the brain of someone who has autism or the brain of someone who has an intellectual disability about like why this is happening? And I would instead encourage us to think about like what are the demands of the environments that many of us are navigating, and how might we be better bridging kind of those demands with kind of the characteristics of folks who are experiencing those forms of neurodiversity. So instead of thinking like, oh, just internally to the person, like this is something that's wrong to them, we might think about what's the mismatch here. So if you remember like those core characteristics of autism I was talking about kind of social communication differences, if you think about how many different types of social communication differences or social communication interactions we navigate over the day, there's a whole lot of them. And if those don't go well, that can be really stress inducing for a lot of us, right? And how we express that stress might be different for each and every one of us. Similarly, I want you to think about the number of times you have to use sort of you have to use flexible thinking or adaptability, or you have to like process information really quickly. How fast are we being asked to do that? Or how often are we being asked to kind of think and flex how we're thinking about things? And if that's something that is an area of significant difference for you from kind of the general population's expectations of that, that also generates some stress, right? And similarly, kind of the executive function skills. So all the different demands that people that we all face through our daily life, and then kind of our skill set or abilities or personal characteristics of how we navigate those. So we think about those core characteristics of some of these developmental disabilities I'm talking about and put those up against some of the demands and the pace of our world and our expectations. I think that's maybe where a lot of that kind of challenge comes as well. So in thinking about, again, prevalence for folks with IDD or intellectual disabilities, rates are a little bit lower than for folks with autism, but still pretty high, somewhere between 10 and 60%, which we know is a big number. If you want to talk more about kind of the research and how we're trying to figure out how to better kind of measure and understand these, I'd be happy to. Probably not, don't have a lot of time within this talk to do that. But in a recent Adolescent sample, it was around two-thirds of the folks with intellectual or developmental disabilities in that sample who were experiencing specifically kind of phobia or anxiety-related disorders and mood-related disorders. So let's talk a little bit about how to recognize mental health support needs. I get a lot of questions from parents in my clinic, and as a parent of a teenager, I find myself thinking about this sort of thing all the time. Like, what is kind of a typical teen versus that's something that's more of a mental health concern? So something that I think it's important for all of us as parents to remember is that it's quite natural actually for our teens to want to they want to what's called like individuate. So they want to kind of develop more into their own person, especially for many of us coming from kind of a Western kind of white U.S. Perspective. It's very natural that they want to challenge boundaries. They may be a little bit grouchy or irritable. They maybe they're naturally becoming more motivated by their peers and kind of interested in peers. And they may be exploring their own like personal identity and how they socially present themselves. So those are all things that we may see some changes that our teens are exploring, right? Regardless of developmental disability status or not. What becomes then concerning for us is if we see really significant or substantial changes that last for weeks or months that seem to hold the person back from things that they typically would have enjoyed or that they would be engaging with. If we're seeing people who are really kind of isolating or separating themselves from everyone, if they're also maybe disregarding aspects of their self-care and their social presentation entirely and not taking care of those things, those are all areas where we sort of see this concern sort of getting in the way of my child being able to do things they normally enjoy. And am I concerned or seeing indications that my child might be getting involved in something sort of dangerous? Okay, that's kind of those are kind of some of the questions you can think about as you're kind of trying to weigh those things. I think also for some of our kiddos, our teens who are on the spectrum or who experience intellectual or the developmental disabilities, similarly, we want to look for changes in behavior of a variety of types. You all know your loved ones and your family members better than anybody. So if you notice a change in sort of appetite, in like withdrawal or social engagement, if you notice changes in their self-care, if you notice if they are a person who engages in repetitive patterns of thoughts or behaviors, do you see a change in that? Do you see an intensity or a change in kind of how those things are manifesting themselves? I think it's totally okay and super important even at this stage too, that we stay connected to the other adults and other people in our teen's life. If our teen is exploring friendships, get to know their friends, get to know the parents of those friends, get to know teachers, get to know other folks in their world as well. And I think in some ways that's something of an advantage that sometimes we as parents, for folks I work with who are parents of kids with intellectual and developmental disabilities, that they oftentimes are more in tune or having more communication with those kind of support folks. Some other interesting things from some of the literature on this is that some of our adolescents and young adults may be so accustomed to like managing like a certain level of stress that they don't realize how impacted their mental health can be. So it's important for us as adult supporters around them to sort of open up those conversations. And we'll talk about what that looks like in a couple of slides. And that also, I think this is important for providers. If you want to talk more about kind of provider considerations, we'll talk more about that next Friday. But that even social communication differences might impact how people seek help. So people might not want to call someone and talk on the phone to make an appointment, right? It might be hard to navigate some of the appointment making software online. What are some of those kinds of barriers that also would be important to consider? Okay, I have a shout out for a resource that I wanted to share with all of you too. If you're not familiar with the Kansas Lend Family Education Series, that's usually hosted by Stephanie Coleman. She does a great job once a month hosting speakers on different topics that are relevant to families and caregivers and people with intellectual and developmental disabilities. Um, and I have some clips from this video that might be kind of interesting for you to hear related to this kind of presentation aspect. So this is just to kind of frame it for you, this is a panel of young women with autism and other co-occurring mental health conditions. And one of them is responding to this idea of kind of sharing like kind of what is what for me? Like where does my kind of mental health condition and my person kind of uh, where do those things kind of
Donna?
Yeah. And so when I was thinking of this question, it got kind of interesting because it when you live at the intersection of a few things, it can be confusing to know what's which thing because it's like, well, is this uh depression or anxiety, or is it just a part of being autistic and have an obsessive compulsive disorder? And so I don't know which to attribute it to, but I wrote a few notes of some things that I experience and how I understand them.
I have to pause it there. And really just encourage you to check out the video because I know I want to be mindful of our time and help us get through more of this content. But the whole panel is an hour long, and I would really encourage you to check it out. We'll share the link to it a little bit later as well. But I think that question of like what's what, I think is one that we hear a lot, and one that as a therapist and a person supporting people is to know that like even though it may be connected in some way and related to kind of your kind of disability experience, mental health challenges can be supported and we can find ways to work through them and find
And
kind of ways to be safe and kind of move through those together. You don't have to tolerate feeling depressed just because you also happen to have a developmental disability. Another kind of common question that I get asked about a lot and that maybe you're thinking about too, and that also is a really common part of exploring teenage life for many of our young people now, is social media. And so I get questions a lot from people about like, is it good? Is it bad? Should I keep them off it entirely? What do I do? And I thought this stat was really interesting, and I thought I would share kind of some resources with you to kind of continue to explore this for your family and for your family member. Right now, about 35% of 13 to 17-year-olds report in a recent survey reported in the American Academy of Pediatrics indicate they're using social media almost constantly. So however we feel about it as adults, it's a big part of a lot of kids' lives, and it's a part of the social fabric of all things a lot of kids are navigating. The jury's still kind of out, and the research is still kind of out about kind of broadly if it's good or bad. It's more about what is it? What extent is it a part of kind of a person's life, and how is it impacting your teens or your child's life? So some of the benefits that exist from the kind of social media and sort of the internet more broadly is these opportunities for social connection, for learning, exploring special interests, finding other people who share those interests, right? Some of the risks, though, are if folks are getting overloaded or accessing like unhealthy content, unsafe content, right? So kind of where the literature stands right now is this question of how. So how is this social media a part of your child's life? How is it a part of their social sphere? Are they using it mostly to connect with other people, to share with one another? Are they are they noticing like kind of a positive affect or a positive feeling when they're engaged with it? Or is it sort of creating other kinds of responses. Is it feeling more negative? Is it feeling kind of overwhelming? Am I getting a lot of like negative feedback or finding content that's not making me feel good when I'm online? And if that's the case, I think we need to really think about gauging and managing how much engagement is happening. The American Academy of Pediatrics has a whole kind of center focused on social media and social media health practices. And they talk about these 5 C's of things that are important. They talk about this idea of knowing your child, knowing the content that they're seeing, understanding kind of what the what the calming effect or how they're maintaining calm when they're kind of engaging with it. Is it crowding out other things? And are we able to have communication around their social media use? And if we can kind of, if if you're thinking about a young person and thinking about those 5 C's and how they are maybe at interplay with your teenager, I think that's could be really helpful. Okay. For many of you parents and caregivers, you're very familiar with the idea that with your child and your family at the center, there's a lot of different contexts that people are navigating and that families are trying to navigate. And so I think when we're thinking about mental health and mental health support needs, it can be really important to activate that support network as well. But given that, we still really have some silos, and that's why I have this picture of 2 big farm silos, where we have for a lot of our teens, where maybe they're functioning in kind of the school space, they're maybe starting to explore, understand more about some of the kind of transition related services, and then kind of mental health and other health services, or maybe there's even like 3 silos here, right? And then as people get older, we have kind of a disability service system and then a mental health service system. And historically, those systems have not been great about communicating. I think there's some work happening here in our state, even in Kansas and through KDADs and some really exciting projects to kind of look at ways to help improve this and grow and improve that collaboration and knowledge sharing and practices. But it's been something that we've not done super well historically. And there's also been this idea of kind of diagnostic overshadowing, where kind of to our video speakers kind of point like, oh, well, somebody who has autism or an intellectual disability, there's this idea that they maybe don't have the capacity to have these sort of emotional types of experiences or emotional types of struggles or difficulties. And we know that's just not true. Okay. I also have to own as a field, as a psychologist and a therapist, that we've maybe focused for too long on focused on kind of compliance focused approaches or coercive approaches versus really supporting a person to understand their whole selves. And so that's really something we're trying to move towards as a field. And I think some of the approaches that we're going to talk about are important. Okay, so quick check for yourself, thinking if this is true or false. Are mental health conditions happening at a rate as high as 60% or more with teens with autism and or ID? Do you remember from the slides before? Kind of think to yourself. You're going to see some nodding. I see some. Okay, maybe you put it in the chat. Yes, that is definitely happening. Okay, so let's talk a little bit about promoting mental health and well-being, because we know this is happening at a higher than kind of neurotypical rate for our teens and young people with intellectual and developmental disabilities and autism. So let's think about how can we promote that mental health and well-being. So I really like this image and this kind of set of 6 ways to well-being that actually comes out of the National Health Service from the United Kingdom. They do a lot of, they're even a little bit ahead of the US in some ways in thinking about mental health and autism and intellectual disabilities in particular. But they have these kind of 6 principles that I think are important for all of us. So many of you on this call are caregivers too, right? So knowing that we have to be taking good care of ourselves and trying to practice in these ways. And so I share this slide. I was initially sort of thinking about this as how are we promoting opportunities for our young people to engage in each of these types of activities? But there's also things I want to think about for myself as a caregiver, as a supporter. Am I taking time to engage in these different types of ways of well-being? And what those look like for everybody can be different. But how am I nourishing myself? How am I connecting with others? How am I being active, in my world? How am I learning how to pay attention to my feelings and my responses in different situations? How am I giving of my skills, my talents, giving of myself to others or to the broader kind of community, to the planet maybe? What am I doing to help kind of contribute back? And how do I continue to learn and grow all through my life? I think for a lot of our teens and young people and adults with autism and intellectual and developmental disabilities, I think if we start with like what opportunities do folks have each day to engage in these different types of well-being, and when we ensure that more of these sorts of opportunities are in place, then I think we see a better buffer against some of these mental health challenges. It's also important, right, to think about natural supports, other kind of community opportunities, are there interest groups, club, different types of peer-to-peer supports that people might be interested in, and making sure we have kind of that baseline established of promoting mental health. Then we can also get into kind of some common kind of coping strategies or coping skills that help us cope with kind of our day-to-day kind of life challenges, right? These are things like grounding practices. Some of you maybe have heard of kind of the 5, 4, 3, 2, 1, where we go through our 5 senses. We identify 5 things we can see, 4 things we can hear, 3 things we can touch, 2 things we can smell, and 1 thing we can taste to kind of bring ourselves back to the present moment, right? There's all kinds of different sorts of like deep breathing exercises. I'm a big fan of square breathing, where you sort of breathe in and out along the edges of a square. There's visualization exercises. There's one I love called Leaves on a Stream, where we sort of like imagine our thoughts to be leaves floating on a stream, and the stressful ones, we can just let those thoughts just float on by and down the stream and around the corner, and not have to engage with them, although we might be having them. Movement, walking, yoga, dancing, playing with your dog, just kind of getting those opportunities for movement, and then thinking about how do we adapt in our environment? Is it too loud where I am? Is the lighting too bright? Do I need an extra blanket? What are the environmental adaptations and different ways that I can be sure I'm taking care of myself? So one way I really like to introduce this to families and teens that I work with is to think about things you already might be doing and to try to maybe make those things a regular practice. So if you already really like going outside and playing with your dog for 10 minutes when you get home, if you don't already do it every day, try and do it as many days as you can out of the week and see how that impacts your mood and how you're feeling overall, your overall well-being. Okay, all of these things help us they serve as kind of protective factors to help us with kind of moving through those everyday stressors. Just for purposes of time, I'm going to just give you a plug to go back and check out this kind of testimonial and the panel videos that I was referencing. But some of the suggestions that they shared in that panel, and that I think are supported also by what we know about kind of evidence-based practice in kind of our therapy and support practices, are to, if you're seeing your young person struggling, ways we can support coping is to offer this kind of kind silence, to kind of come alongside our young person, to maybe ask fewer questions. And if the questions we do ask, to ask them specifically about something we can do here in the present moment to help with their comfort. To try to break down the things that we're saying or the things that we're doing into smaller parts, so we're not kind of moving too fast or too quickly into anything. And just kind of read and watch kind of the person that you're alongside, and to know, do they seem to be relaxing as I come closer to them, or is it better for me to give them more space? Okay, and really consider, I think especially for our folks on the autism spectrum, kind of the physical needs that they might have in the physical space. So I've taken to asking folks now, how's the lighting where I am? How's the sound? Can I get you something for the temperature? Would you like a drink of water? Can I get you a snack? Those little small comforts kind of feed into the kind of initial level of need that we have to help us feel comfortable to get to a place where we can do more intense or more ongoing problem solving. For many of you, I know you're probably wondering like, okay, I'm not sure yet if we're ready, if we want to seek help or if we need to seek help yet. But if I'm starting to notice some of those things on the kind of typical teen versus maybe getting into kind of impacting or impairing kind of mode, there's going to be a time, right, for a conversation around help seeking. And so some of these suggestions come from guidance from the NIH around facilitating adolescent mental health. And thinking about being in the right time in the right place, having some quiet, having some peace, and then being able to share with your teen some things that you've noticed, asking if they feel comfortable telling you what's going on, emphasizing that you're here to listen and here to help, and to let them know they're not alone, and it's not something that the two of you are only responsible for solving, that we can bring in other people, maybe a counselor, a therapist, maybe your school counselor, school social worker, maybe another supportive person who would be able to be kind of a co-problem solver. And then I think to be direct and sort of say, if you are concerned about, self-harm or harming self or others, to sort of directly ask, and to try to stay calm, and non-judgmental in your response, but then to kind of take steps forward to get that support. So when you're ready then now to kind of seek out that support, oftentimes folks may start with a primary care provider if you have one. So to reach back out to your pediatrician or your family medicine provider and share that you're looking for support and connecting with like a counselor or a therapist, right? If this isn't an immediate crisis need, and we'll talk about kind of crisis in a few slides. They can often share resources kind of within your community. There's also, if you have insurance, kind of checking with your insurance provider about who might be in network, who provides, therapy or counseling support and has some familiarity or openness to supporting a young person with a developmental disability. I would encourage you to reach out to the Kansas Family Support Center. That's one of the things that they do is help connect families to various supports by, hosting things like this, as well as supporting families on more kind of an individual basis as well. And then there is a great website out there called effectivechildtherapy.org that provides some different directories where you can kind of type in where you live and your concern, and they can kind of match up like providers who might be in your area as well, who are using kind of effective and evidence-based strategies for supports. So I'm not going to claim that it's an easy and a quick process, but it is a process that we can get through and that you can do it. Okay. And also I would encourage this for our providers as well, that these are skills that we can all learn to adapt, and be supportive of all clients of all abilities who are coming into our clinic, and into our kind of spaces. Okay. Of course, it's important. Oh,
I just wanted to let you know that you have about 15 minutes left.
thank you so much, Renee. Okay, so when we think about seeking out therapy and getting therapy that's going to be helpful and effective and impactful, we know that there are some pretty effective therapies out there, and I'll list a few of them for you. And I also want you to know and be encouraged to know that as a field, we are getting better every day at understanding and learning how to adapt therapies to be more accessible. Okay, so I do not want you to accept any clinician telling you that, oh, I'm sorry, because your child has autism or because your child has an intellectual disability, that they're not going to respond to this therapy. I just don't accept that. Okay, what's important is getting to know the person who is coming in to your office and getting when I'm thinking about myself and I'm meeting, say, your teen who's coming into my office, I need to get to know that person. I need to know kind of what this person's strengths and characteristics and interests are. I need to know their support networks. I need to know what they want to work on. And then what I'm going to bring to this scenario is flexibility, patience, and a knowledge base of like what exists out there in the evidence base for us to then bring all this knowledge together and try to make progress with that person. Okay. So the next like 2 or 3 slides are really broad overviews of some of kind of the progression of research about what we've understood about what kinds of adaptations are the most helpful. So I'm going to move through those quickly. Because what I want you to know is we've done this first by asking clinicians what they do. More recently, in 2023, a study came out where they were asking adults with intellectual and developmental disabilities what they needed from therapists. And then in 2021, there was also a kind of review of the literature done for interventions for and mental health supports for kids under the age of 18 to say like what are the adaptations people are doing or people are making to do this work and make it work with kids and teens with this profile. And what I would summarize for you as the overarching adaptations for people to think about are not going to probably surprise you. But there are things like making sure we're using clear language, maybe providing extra structure or extra ways to be structured yet flexible. We want to incorporate the person's interests and then think about how we might provide like support, so a visual support or use other types of kind of support tools to help with supporting that process. Okay, so if you've been supporting a person in another type of context, like your family, say, for probably their entire life, you're probably familiar with each of these sorts of things, each of these broad strategies. And so I want you to know that it's fair to ask your therapist to think about how they are going to do these things in working with your teen when you go to seek help. Okay. These are a few of the strongest evidence-based psychotherapy forms for anxiety or depression or self-regulation. Okay, so these are terms I want you to be asking about or talking about with your provider when you're working to establish, say, with working with a therapist. So I want you to be familiar with terms like cognitive behavioral, dialectical behavioral therapy, or acceptance and commitment therapy. Okay, these are each a little bit different, but they all relate to understanding the relationship between our thoughts, our feelings, and our actions. And they each have a little bit different strategies for how we manage them and how we respond to them. But there's concrete practice and work to recognize those things and learn new strategies and skills. Okay. I added a slide in here to encourage you all, or think about if you don't already have kind of a set of questions or haven't kind of yet had that conversation with the therapist, or maybe you have a therapist and you want to explore this further with your child or loved one. I want you to find out from that therapist, how do you build relationship with your clients? How do you incorporate their strengths and interests into the work that you do together? How do you adapt your communication style, your materials for your clients so that they're understood and accessible? How do you promote self-determination in the support you provide? And how do you involve caregivers or other supporters, right? Our teen is the focus person, the person we're supporting, but they may have other caregivers and other folks involved that they think are that are important to them, and helping kind of practice and make those things happen that they're working on in therapy too. So I think a big thing that we want to be happening in any type of therapy, but that I want to just emphasize even more particularly for our teens and kiddos with autism and developmental disabilities, is this involvement in goal setting and support planning. What does the teen want to do more of? What are the contexts that are important to that teen? Where do I already feel successful, and how can I grow from that? Because that's how we get buy-in and engagement and support to move through and better manage some of those mental health challenges. I have in the next few minutes some resources I want to share with you, and then I also have kind of a web repository where I've put a lot of these things to that you can go and check out after this, because 1 hour is definitely not enough time to really dig into this probably as much as we'd like to. But I just want you to know that these things are out there, and it's fair to bring these to providers that you're working with and ask them to use them. Okay? So I want to first, encourage you and let you know it is okay to advocate for the environment to be more accessible for your teen, for your loved one, for your family. Okay? You could share the image that's on the screen here is actually a flyer that was developed by our KU Center on Disability Community Advisory Panel, who have some general guidelines for healthcare professionals in general about how to make any kind of healthcare visit more accessible. But I think it's something that I share with any type of providers that I'm working with, teaching, to share with them as a resource. And so I think it's fair to share this resource with them, ask them about being more explicit about some of these sorts of things, to really, it starts with that kind of physical environment experience. We want to create a hospitable environment where someone feels welcome. And so considerations of those accessibility needs are important. There's a couple of toolkits that I want to call out for you all that are meant for individuals seeking therapy or seeking behavioral health support, but that family members can be huge supporters too. And also I think are just I think more clear language ways of explaining how do we manage our behavioral health and how do we approach seeking out therapy. One of these tools comes from our own Kansas Council on Developmental Disabilities and Whit Downing, who you're going to hear from here at the end of our talk. There's also a mental health therapy toolkit. That's a guide for kind of what to expect as you're going into an individual therapy session. So I think both of these provide really great resources for individuals and for families. There's also even kind of a guide within the Kansas Council on Developmental Disabilities toolkit that talks about what to expect if you're calling 988. And I want you to know 988 is something that your loved one, your family can utilize, even if you have a young person who has communication differences or has a developmental disability of some kind. There are ways that we can navigate that crisis system together. So there's kind of a plain language or clear language of what to expect if you're utilizing that. Okay. I have I also think it's great to model self-advocacy. So I have just some example kind of I statements that you can utilize. And I really enjoy, I think acronyms are really helpful. So thinking about as you're supporting your loved one and they're working in therapy to use this model called STEPS, state the problem, think of possible solutions, evaluate the options, pick one to try and see how it works. We often talk a lot about kind of behavioral experiments, things that we're going to try. Okay, I have a little bit more in my talk around promoting self-determination, but I want you to hear from Whit, and I want to have the chance for people to ask some questions before the 2 o'clock hour. So I mentioned self-determination. I encourage you to check that out. But I also want you to hear from Whit Downing, who gave a ton of input to me about this presentation. Wasn't able to be here today, but did record a video message for you all. And so I'm going to let you listen to kind of Whit's perspective on all of this, and then take the last few minutes for questions.
So my name is Whit Downing. I'm 29 years old. I'm autistic and I live with mental health challenges. I really liked how Jess talked about in this presentation the difference between typical teen behavior and when that behavior is a concern for mental health challenges. As a teenager, I had a lot of concerning behaviors that were not just part of your everyday typical teen behavior. I refused to go to school like every single day. I isolated for days at a time. I engaged in self-harm behaviors. And I remember people around me being confused and angry, frustrated, and just not supportive. As an autistic teen, my behaviors were screaming that I needed help, and I really needed someone who knew how to listen to what I wasn't able to actually say with words. I was communicating. I was communicating my anxiousness. I was communicating my overwhelm. I was communicating that I was really, really, really struggling to make it in a world full of sensory overwhelm, social anxiety, depression, sadness, just everything that is really hard that I didn't know how to communicate. My behavior was communicating that. And now as an adult, I really, really see how important it is to meet young people with IDD. Well, any young person, but especially those young people with intellectual and developmental disabilities like autism. Just meet them where they are. That can really make a huge difference in their life. They may not say, hey, I'm anxious. They may not say, I'm sad or I'm scared, but their behavior may be saying that. So your role as caregivers is really, really powerful. It can mean the difference between a young person giving up or just holding on a little bit longer. It can mean the difference. It can make someone feel understood for the very first time. I am so thankful now for all the support I have in my life and for everyone who has listened to me and everyone who has helped me understand my emotions and who has looked past any problematic or whatever kind of behavior that I've ever had. I'm so thankful for the people who have been able to look past that and really support me and help me. I do have.
Oh. Whit told me that it got cut off, but that all she was saying was at the end was she was just very thankful and was proud to be where she is today. Also, Whit would want me to share with you that there is a support group, virtual support group that meets once a month for teens and young people and people of any age, or people 15 years and older, so adults as well. That's a mental health support group, and it's co-facilitated by a person with mental health and IDD needs, as well as a therapist or mental health professionals available kind of on standby as well. Okay. I will pause there or stop there and say thank you and leave it open to any questions.